Lots of pre-ops, a few things left over from yesterday, one heart in progress.
Covenant's chaplains begin each day with a morning summary from the overnight on-call chaplain.
Be with us today as we are your hands and your feet.
Chaplains put on up to 4 miles each day walking 3 campuses at Covenant. Today, Betty Zeestratton is showing a new chaplain how to get to the neonatal intensive care unit.
I discovered chaplaincy kind of by accident, that through going to visit parishioners, church members that were at the hospital, and I always felt that there were more skills that I could learn and be able to address in a better way for them. And so then I discovered there was a chaplaincy program here at Covenant.
Patients at Covenant are as diverse as our community around us, so chaplains must learn to adapt their conversations accordingly. What's important to know is that few like to be in the hospital.
It seems like when the person is sick, they're off of their normal routine and their comfort zone, and they're in an unfamiliar setting, which the language is much different, and they're not able to feel at home and feel at peace. So a lot of times a chaplain can go in and help find the support that a person has, whether it be religion or whether it be family or whether it be, I've even talked to people who are motorcycle riders and their peace is riding a motorcycle. So I don't know anything about Harley Davidsons, but I will talk Harley Davidsons with them.
Chaplains train to be good listeners, but sometimes it's life experiences that help these counselors understand what the patients are feeling. It wasn't too long ago that Betty was here facing the same fears her patients do.
Something was just not digesting correctly in me. And from that point on, quickly I had many CT scans, MRI, a PET scan within the course of maybe 5-6 weeks to find the pancreatic cancer.
Within 2 months of her first consultation with oncologists at Covenant, Betty was starting chemotherapy.
For the first 3 months, it was every 2 weeks. I was coming in for an all-day infusion of chemo, and then I took home a pack of chemo for 3 days. Then 2 weeks later, the entire routine started all over again. So I did that up through March, and then took a little break, and then had the pancreatic surgery.
3 months after surgery, Betty started treatment at Covenant's Radiation Treatment Center.
I got the sickest with the radiation. So poor Dr. Zaki, I got to see me at my worst. And I really, I couldn't eat. There was a period in there for 10 days I couldn't eat. Ann Hoffman, who is our dietitian, nutritionist, was very helpful with me at that time because I couldn't eat. I knew I needed some kind of nutrients.
Betty's therapy was exhausting all the way through Christmas of 2018.
After radiation, I was so weak, I did take a couple weeks off of work, but I needed to get back my strength, so I have a treadmill at home, so I forced myself to get on it and first get up to a mile and then to speed up the mile, because while I'm at the hospital I have to walk a couple miles a day as a chaplain through the hospital, and so I needed to get that strength up. And once I was able to start to slowly eat again, I still have some eating difficulties, so I do keep in contact with Ann. Another really helpful person to me was Angie Bradley, who is my nurse navigator, who helped me to coordinate all of the care people and would suggest, people that I could talk to help me with the needs that I had.
You want spray?
No, you don't need it.
Band-Aid?
Band-Aid would be good.
Today, Betty follows up with her oncologist and surgeon every 3 months. They've elected to keep her chemotherapy port just in case they find evidence of cancer.
The port that I have can stay in me for several years, up to 5 years. So in case the cancer comes back, they can quickly access it and I can get treatment rather rapidly.
Betty certainly wants to learn more about illness to better understand the patients she helps, but she never intended for such an education on cancer.
I found the pancreatic cancer website, which has been very helpful. They have tons of information that supplemented my education on what I have and the treatment options. And what Covenant was offering here was exactly what I found online through several sources.
Having all of her treatments at the same center also helped, and she felt secure in the fact that all of her doctors were consulting with each other.
My surgeon, my oncologist, the radiologist, my primary care doctor, they've all been networking and communicating. The My Chart that we have, that is the electronic record of our medical records that we can access, would have everything in there also. So, and all of those doctors had access to that.
Betty is quick to credit her coworkers at Covenant with her recovery.
The other chaplains have been just super. The whole team had rallied around me and assisted me so that I could continue working, which helped me with my wellness. And also, they were there to help me when I was really in my worst part of this treatment. So they really love them a lot, and they've been a great support.
That support includes knowing when not to try and cheer someone up.
I think when a person's really down with cancer treatment, you want to make them feel well, and sometimes you just need to let people cry. I know that was too part of the experience for me, are the days that I had that were really, really rough. I'm so thankful that people didn't come in trying to make me feel better. I just needed to feel that, and that was really important to know that there are times when people are going through traumatic illnesses where you know, it's okay not to make them feel like the sun is shining. It's okay to sit with them and let them be where they needed to be. I needed to be there, and I'm thankful for the friends who just pulled Kleenex out for me.
Betty knows her experiences can help others at the hospital, patients and co-workers who need a good listener.
We love having you, and I know the parents enjoy it, and they get a lot from you guys, and they get that comfort and that support.
Covenant's care team is here to help you when you need us. You can learn more by visiting our website at covenanthealthcare.com.